People have been inadvertently using antibiotics for millennia, primarily using molds and plant extracts to treat bacterial infections, and it was anyone's guess if it would work. It's only since the late 19th century that we've been able to pinpoint specific antibacterial agents for different infections. Today, over 154 million antibiotic prescriptions are written every year in the United States. And we not only know which antibiotics to use, we also know how to use them effectively and appropriately.
So when taking an antibiotic, first and foremost, you should always take it as directed. If your physician tells you to take the antibiotic for 10 days, take it for 10 days. In addition to that, if you have, for whatever reason, antibiotics left over from a prior infection, you should never use that antibiotic to treat a new infection. And one of the reasons for that is you may have a different infection. For example, if you were prescribed a Z-Pak for an upper respiratory infection, the Z-Pak is not going to do a good job in treating a urinary tract infection that may develop. So you don't want to use it. Another thing that is important is you should never share antibiotics. A friend becomes ill, you have some left over from one of your prior infections, and you give it to a friend of yours. Not wise to do. You don't know if that patient or that friend could be allergic to the antibiotic, or if they will have some untoward side effect from the antibiotic, so it's not wise to do that. You should also never pressure your doctor into giving you an antibiotic if your doctor does not think it's indicated.
Even when used appropriately, antibiotics come with potential side effects. The most common side effects affect the digestive system. These occur in 10% of patients.
People may not know there's good bacteria that live throughout our intestines. When you take an antibiotic, not only if you have a bacterial infection, not only is the antibiotic effective in treating the bacterial infection, it also will eliminate the good bacteria. And then what can happen is you can develop one of the more common side effects of taking an antibiotic, which is upset stomach, gastrointestinal distress, diarrhea, among other things. So antibiotics, when they're taken in general for infections, can cause those side effects, but they can also cause that harm when you're taking it not for the appropriate reasons.
Best case scenario is a couple of days of tummy trouble. That's an acceptable risk when you're in dire need of an antibiotic. It's also a good example of why not to take an antibiotic when you don't need one. The medication won't cure what ails you, and it could add gastrointestinal distress on top of it, or worse.
Another issue that can arise, which is a more complicated and more serious side effect, is a condition called colitis, which is caused by an organism called C. diff. Patients may commonly know it as C. diff. And that can be a life-threatening situation. It can cause severe colitis, which would result in diarrhea, bleeding, and severe abdominal pain and fever. And in very severe cases, it can cause death.
Antibiotics are so effective that when penicillin first became readily available, it was nicknamed the wonder drug. It saved many lives. When used for the right reasons, antibiotics truly are a wonder drug, and all these side effects are worth the risk. A conversation with your physician can help you use the antibiotic correctly. She can also give you advice about giving your good gut bacteria a little TLC to combat those common digestive side effects.
A lot of the foods that you eat contain what we know now as probiotics. So you'll see that on yogurts and some forms of cheeses, and now there are some drinks that are fortified with probiotics. On an everyday basis, it's probably a good idea to eat meals or eat foods that have probiotics, essentially. And so then when the time arises for you to take an antibiotic, your gut is basically prepared. And then after you take an antibiotic, or even sometimes during, depending on what your pharmacist or your doctor would recommend, you should take a probiotic to help replenish that bacteria that was eliminated from that course of antibiotics that was taken.
Some probiotic-rich foods are kefir, yogurt, apple cider vinegar, and fermented vegetables like sauerkraut, natto, miso, tempeh, and kimchi. If indicated, you can eat these foods at the same time you take your antibiotic, and thankfully, yogurt tastes a lot better than mold. I'm Dr. Daniel Applebaum, and you're watching the eHealth Network. See you next time.